Hello and welcome. My name is Mary Catherine Lundquist, and I work at the COPSA Institute for Alzheimer's disease and related disorders at Rutgers University. Thank you for joining today and listening in to learn more about how you can help create an environment at your adult day center that is supportive of your participants with memory loss. The tips and strategies we are reviewing will benefit the people you are caring for and you as you go about your daily work routines. Thank you for all the good work you are doing. It takes a special person to work in adult day services, and I hope these materials help you have a better day at work. This is the fourth in a 7-part series on the Foundation's workbook. You can download a free workbook at our website, www.care2caregivers.com. Part 4, we will be reviewing communication. If you want to follow along in your workbook, this section starts on page 34. Communication is an ability that we take so much for granted, and it can become a tremendous challenge for people with dementia. As a dementing illness makes its way through the brain, it damages the many areas associated with our ability to communicate. Communication is a process that relies on more than the words we use. We also communicate with our facial expressions, our gestures, our posture, and our tone of voice. Some language issues that individuals with memory loss diseases experience include having difficulty finding the right word, forgetting the meaning of the words, or sometimes repeating the same words and phrases over and over. This can lead to all kinds of difficulties when we are trying to communicate. When we add to this some normal changes that a person may experience as they age, such as hearing loss problems, the picture gets even more complicated. As a person ages, they may normally need more time to process information, which can also impact communication. Other issues we may encounter that impact communication in adult day include language barriers. Many individuals with memory loss who speak multiple languages may revert to speaking their primary language as their illness progresses. This may be an issue if we do not have staff who speak the primary language of the client. Even if we do have staff who understand the languages spoken by clients, there can be a wide variety of dialects within a language which may contribute to misunderstandings. Many cultures and communities have terms whose meaning may not be readily understood by those outside the group. The issues we just reviewed may be obstacles to communication, but take heart because there are things we can do to assure that we are connecting with the real person who exists behind the impairment. The first important thing for us to remember is that no matter how nonsensical it seems, any attempt that a person makes to communicate should be respected. This means that we are patient, we are open, and we look for the deeper message behind a client's attempt to communicate. What are some things we can do to help enhance communication with our clients in adult day? Let's consider some of those. Each person's language abilities may be different in our adult day center, but here are a few things we can all keep in mind to support positive communication. The first is to speak slowly. It may take an older person with memory loss more time to process what we are saying. We can use simple words. This means keeping the sentences brief and sticking to the point. It can help if we wait. If a client is taking a while to formulate a response, that is okay. We can wait. That pause that we offer them may make all the difference, as they may need some extended time processing the information. We can try to stay relaxed and calm, especially if the participant is getting upset or frustrated. The tone we set with our attitude can make a difference. If you seem to be stuck and you and the client are just not understanding each other, you can always try restating your question, comment, or request using different words. Sometimes that helps. If you'd like to read some additional tips to help with communicating, you can refer to page 40 of the Foundations guide, as we have lots more tips there. Remember that the feelings you express in your voice and with your body are sometimes more important than the words that you say. Language is so much more than the words that come out of our mouth. Sometimes the meaning is in how we say it. In addition, we communicate with our bodies, our posture, our facial expressions, and our gestures. So remember that the feeling you express in your voice and with your body can be more important than the words you say. Stopping to check in with yourself before you have an exchange with a participant can help you get in the right frame of mind so your body language and your voice tone supports the message you want to convey. For instance, if a participant is upset and we are speaking quickly, tapping our toe while standing in front of them with our arms folded, chances are they are not going to get the message of patience, care, and calm. Checking to make sure your verbal language and your body language match can be very helpful. Let's take a deeper dive and review something that can support communication. Successful interactions rely on cues. We can think of cues in three categories. The first is visual, which means it is something we see. Visual cues include eye contact, pointing, showing a participant an object during an activity, reading a note, or looking at a picture. Verbal cues include things that we hear. Verbal cues can be spoken words or even music and song. An example of this is when we hear a peppy, upbeat song, we may want to tap our toes and clap. We often use music during exercise sessions in Adult Day to get participants motivated for exercise sessions. The third type of cue is tactile and involves touch. Let's look at some examples of cues. A visual cue that we may use during our day at the center includes gesturing with our hand toward a chair to encourage a participant to take a seat, or maybe passing around an illustration or picture during an activity that people can look at in hopes of encouraging their engagement. An example of a verbal cue is when we use music during activities, either to get people to feel calm and relaxed or to kind of get them pepped up and wanting to move for our exercise sessions. We also commonly use verbal cues when we tell a participant to do something, such as, let's walk to the lunchroom, or eat your lunch. Tactile cues are also helpful in Adult Day. An example is if we pass around an object that people can hold, say for instance a shell if we are talking about the beach. Another example of a tactile cue is lightly touching a person's elbow to encourage them to take a bite of the sandwich that they may be holding in their hand. Successful interactions rely on a variety of cues. Sometimes we just need one level. Other times, the exchange is enhanced by 2 or 3 levels of cues. The level of cueing may need to be increased as the level of difficulty of the task increases. It's good for us to start with the lowest level of cueing and advance to a higher level in order to foster a meaningful exchange. The bottom line for us as we communicate is to expand our understanding also of what it means to listen. Communicating is so much more than words. Listen to the subtext. This is so important when we are supporting individuals who have memory loss. We must listen with our hearts as well as our minds. We must be sensitive to the emotions expressed, not just the words, because we know that our participants have a hard time finding the words. I want to go home. How many times have you heard that at the center? I want to go home is a phrase we hear often. Sometimes this is an expression of anxiety, but it can also be an expression of loneliness. When we recognize the emotion, we can choose a response that matches that emotion and responds to that emotion. If someone is anxious, we can reassure them. If they are lonely, we can talk to the person about their family. If they are confused, we can lead them in the right direction. People with dementia have a full range of complex and powerful feelings. Just because they can't express those emotions in words does not mean they are not there. As day program professionals, we have to learn how to decipher what people are feeling, even though they may not be able to verbally articulate their feelings. We hope that the tips covered in this presentation will support your positive communications with your participants at your Adult Day Center. Let's take a minute to review. Be patient as you engage with clients at your center who are having difficulties communicating. Try to show respect and caring in each exchange, especially if the individual is struggling. Observe a person's body language, their facial expression, and even posture, and be aware of what you may be conveying with your nonverbal body language. We may not always get it right, but we for sure will be doing our best if we pay attention to the feeling that the person is trying to express. And lastly, it's always good to ask the person if you've got it right. After all, isn't that what we all want? To be seen, heard, and understood. Knowing that someone is hanging in there with us as we struggle is truly a gift. Thank you for your attention and your willingness to learn about communication. I hope the information shared in this session will make your job easier. For more information, please contact us at 800-424-2494. You may also download the Foundation's workbook at www.care2caregivers.com.